Hello, Health Science 3202 students. This is Professor Van Dyke, and I'm giving you your video for this week. This is the week 3 video titled Legal Framework, Policies, and Practices for September 8th through 10th. I'm going to try and squeeze this into one video, but I may have to do two because this is 51 slides. But I'm going to give you the general information and we'll see how it goes time-wise. So again, this is a discussion of the legal framework, and really what I wanted to focus on for this particular lecture is a little bit of materials in regard to OSHA, so the Occupational Safety and Health Administration, responsible for the Occupational Safety and Health Act. But I wanted to kick off the lecture with the first 20 some odd slides regarding what the state has been doing for COVID-19. So if we're talking about legal frameworks and policies and practices, what a great time this has been to kind of see how the state steps up and handles specific policies and procedures in regard to protecting public health. And what a fascinating time. So you've seen where CDPH has stepped in and said, okay, this is what we really need to do, and we're going to enforce this, and we're going to require businesses and occupational settings and social settings to do the same thing, including cohorts and schools and things like that. So again, if you have questions about this stuff, make sure and email me your questions. We're going to move on to slide 2, which is general prevention. So this actually came from IDPH, which is obviously not CDPH. IDPH is the state of where is it? Something that starts with an I, probably Illinois. But this was one of their guidelines in regard to some of the stuff that they rolled out. And as you can probably see, it's very similar to stuff that has been kicked out by the state of California from CDPH. So CDPH is the California Department of Public Health. So if I say CDPH, please do know that that's what I'm talking about. It's the state of California, their public health department. So they're basically saying the same thing. Don't touch people, avoid hand-to-hand contact. So everybody's been doing the elbow bump and whatnot. But again, that is essentially getting within that 6-foot barrier. So a lot of people have avoided that. I know I've been meeting with a lot of people, and we've been doing virtual handshakes from across the room. It seems silly, but when you're talking about keeping that 6-foot distance, it really is very important to do so. So stay home when you're sick. If you feel sick, make sure you're getting lots of sleep. Wash your hands thoroughly. Generally, our rule of thumb is 30 seconds, soap and water, but to sing the happy birthday song in your head twice while you're doing it, not to rush it, sing it at a standard pace. Then, of course, wearing the cloth masks, very important. So here in California, this is absolutely vital, and most stores that you go into are requiring that. If you go to other parts of the United States, this is not something that they're requiring, but here in California, because of the large population, CDPH is working very hard to make sure that anywhere you go, you're wearing these masks. Avoid touching your eyes, nose, mouth. Certainly a quick way to spread the COVID-19 virus. Cover your mouth when you sneeze. So if you go to a COVID checkpoint where they're actually checking for coronavirus, they will have you leave your windows up while you're swabbing your nose, just in case you sneeze or cough. Clean with disinfectants, and call before you visit your doctor, because a lot of doctors are inundated right now, so obviously very swamped. And then you can see with the bottom of this form for IDPH, there's a telephone number for contact. And you'll also notice that with all the materials for the California Department of Public Health, there's always an access point that you can call and talk to these individuals. On to slide 3. This is PAHO. This is generally for most of South and Central America. They work through PAHO, and this is essentially what they're saying, which is very similar. And you can take a look at this, and that you're basically seeing the same thing repeated. So everybody's got a consistent method, which is really important, because you may see, for instance, if you go to one place, if you go to, like say for instance, if you're in Wisconsin, a lot of the stores are not requiring that you wear a face mask, and then that can be very disruptive to that continuity. And you come here to California, and all of a sudden you're required to wear this mask everywhere you go. So again, that's a fairly important message that really with coronavirus we hadn't exactly seen that consistent piece that everybody was doing the same thing all the time. So it's been very interesting to kind of see this all play out, and certainly one of those things where it's a state right versus federal requirements, that places they're operating in very different fashions, but certainly here in California, we're always very precautious, and Gavin Newsom has definitely taken that stance with coronavirus. On to slide 4. This is a CDPH slide here, and as you can see at the bottom, there's a CDPH page that's listed that you can actually go and look at these things. But 735,235 cases, which was up 3,000, and this is as of September 7th. So the numbers were dated September 6th, but they were posted on September 7th, and this is constantly updating. But you can see 13,726 casualties, very high. Gender breakdowns, ages. So this is something that CDPH likes to get across, and you look at the numbers here, and obviously when you think about mortality rates, obviously they're not age adjusted. There are a lot of people between the ages of 18 and 49, and you see that as the largest percentage of people that are actually confirmed cases for coronavirus, and lots of numbers here getting thrown around on this particular slide, but there's a lot of useful information. So when you look at this from day to day, you get a good idea of what's actually taking place. And if you've been following this for some time, you'll know that the numbers have been all over the place, and certainly with the holiday weekend here upon us, I would anticipate that there's going to be another spike within the next couple weeks. So keep your eye open for that. Follow these numbers and see if that trend holds true, and people are going to start calling us Nostradamus because we can make these predictions, but essentially we're just making statistical values. We're making a statistical assumption based on what we would anticipate to see. So very interesting stuff on slide 4. On to slide 5, we're going to talk a little bit about some of the COVID-19 policies and practices. And again, we're going to kind of get through this as quick as we can because we've already talked about some of this stuff. Stay home except when you need to go out. So a lot of us have been in self-isolation. I did have to travel during the coronavirus outbreak, and in July I went from Wisconsin to California through Denver. I've been to Tijuana, Mexico, and seen how people are handling these things, and certainly very challenging. Everybody's kind of doing it in a different fashion, but certainly the face mask and staying home as best as possible, social distancing, certainly something that we try to do, but depending on where you are, I know when I was at the airport in Denver, there was no such thing as social distancing as soon as they started boarding those planes. So I know for me, I just waited until the end and got on the plane, but of course everybody was crowding around me, so social distancing was virtually impossible. You know how close airplane seats are, and certainly while I was on that flight, I looked around me, and the people that were sitting to the right and to the left of me had removed their face masks. So again, we do the very best we can, but people are they're given what they believe to be inalienable rights, and sometimes state practices and federal practices seem to infringe upon those things, where people get a little bit dicey and will choose not to follow those rules. So these are directly from CDPH. The next 20 slides, we're currently on slide 5 right now. The next 20 slides are all directly from CDPH, and what they're saying are the policies and practices for protecting individuals specifically from COVID-19. So stay home, self-isolate as best as possible, practice social distancing, stay 6 feet away, and you see a lot of the stores and whatnot are really working very hard to make sure that you know exactly what 6 feet are. They've been giving individuals a lot of guidance towards that. So 6 feet away, wear a cloth face mask if you are leaving home, and wash your hands with soap and water. Again, it says 20 seconds, but I'm a firm advocate that extra 10 seconds for a 30-second hand wash is ideal, really, for washing your hands. We'll move on to slide 6, which is a continuation. Clean and disinfect frequently touched surfaces daily. So looking at your cell phone here. Do the very best you can. Don't ever set your cell phone down onto a counter or things like that. Always keep it very close to you, and do the best you can to protect yourself from setting that phone down. But again, fomites are covered with bacteria and viruses. So everybody knows what a fomite is. A fomite is going to be like a doorknob. So you touch that doorknob and then you immediately touch your cell phone. So again, you want to clean and disinfect surfaces as best as possible, as frequently as possible, and certainly take those precautions when you can. You want to avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with tissue, or your elbow, which is the vampire cough. Certainly a very productive means for controlling that viral spread, which is very important. And then certainly, again, to wash your hands if you sneeze or cough into them, or come in contact with these dirty surfaces. On to slide 7. Continuation again. You want to avoid close contact with people, especially people who are sick. If people are sick, whether they've been diagnosed with coronavirus or not, you want to avoid them as best as possible. If somebody does become sick in your home, you do want to isolate them in a bedroom to allow them to manage their symptoms themselves, to be in isolation, to not be touching things throughout the house. You literally want to set food outside the door and allow them to come get that food if they can. But if not, you can take the precautions for entering that space. Stay home and away from people if you become sick. If you smoke or vape, consider quitting. That's just a great rule of thumb, no matter what. And it certainly is a good opportunity for people with respiratory conditions to understand that this is going to inflame the potential for risk factors for having negative health effects associated with coronavirus. So on to slide 8, policies and practices continued. This is, again, all information directly from the California Department of Public Health. So who's at higher risk? Certainly, when we looked at all the information that came from China and what we've seen here in the United States, one group that is a specific high risk are smokers, older adults at 55 plus, 65 plus, individuals with compromised immune systems, so people that have autoimmune deficiencies, things of that nature, but also have people who have serious chronic conditions like heart disease and diabetes, lung disease as well. On to slide 9. What should you do if you're at higher risk? And it's going to sound very familiar. Stay home, avoid contact with people who are sick, consider ways of getting food brought to your house. So this is certainly one of those things that if you have a close personal friend or family member, this is a good means for doing that, to have those individuals get groceries for you and bring them to your house. And to minimize that risk as best as possible. And certainly when you go to stores, you don't want to be handling a lot of extra stuff. So go in, get what you need, and leave. Try not to pick up extra things and look at it and go, do I really need this? Don't I? But certainly you do your best to minimize that. And from store to store, you'll notice that they actually have rules associated with using your own recyclable shopping bags right now. So it's very interesting how everything's kind of playing out. Move on to slide 10. Slide 10 is typically people will have specific symptoms for coronavirus. And again, California Department of Public Health wants you to be aware of these things. So do you have a fever, coughing, shortness of breath, chills, muscle pains, headaches, sore throat, and loss of taste or smell, which is kind of the new addition here. The rest of this stuff is like, well, I got a regular cold. I've had these colds, and these are always the symptoms that we have. So how am I supposed to tell the difference? And one of those obviously novel new pieces is that a loss of taste or smell that wasn't there before. On to slide 11. What if I have these symptoms? So this is an outline from the CDPH. If you are a patient, what should you do if you have these symptoms? And certainly you want to call your healthcare provider and let them know what's going on. Make sure and call them so they know that, I have coronavirus-like symptoms. I'm coming in. I need your help, doctor. So these are things that you really want to do. You want to understand your travel history. Take precautionary measures. Make sure that you do a great job of washing your hands very thoroughly before you get into your vehicle and drive to the hospital if they request that you do so. They may actually request that you stay home and self-isolate to control this and to minimize the risk in hospital-based exposures. So again, on to slide 12. If you're a healthcare provider, what is the right thing to do? And this is an outline of what you're supposed to do if you're a healthcare provider. You want to isolate patients within the rooms. The patient should be placed in a private room with a closed door so that other people aren't being exposed to it. And there are definitely a lot of regulations in regard to what the facility themselves should be doing. How often should they be cleaning? What percentage of cleaning materials should they be using? All these things are handled with the healthcare provider information that you can get from CDPH, and it's also here on slide 12. On to slide 13. What should you do if you think you're sick? Again, you want to call ahead. Make sure and talk to your healthcare provider before you seek that medical attention. You want to know exactly what you should do. And again, CDPH is making these guidelines. Each hospital is individually controlled, and certainly depending on their risk levels and what they believe to be the right avenue, they're going to have a little bit of flexibility in regard to how they treat specific patients. So if you call into the hospital and you say, I can't breathe, what am I supposed to do? There's a very good possibility that they're going to have you come into the hospital, but they will take specific precautions to protect you and the people around you. It's slide 13. So on to slide 14, do I need to get tested for COVID-19? And this is basically a flow chart from CDPH. If you're experiencing fever, coughing, or shortness of breath, the first thing you do is you call your physician. The doctor may advise you to come in. The doctor may advise you to self-isolate, or the doctor may request that you call 911 and that you're handled in an appropriate fashion. And this is a flow chart that allows you to figure out what is best for you and for your community to keep you safe. On to slide 15, what is the treatment for COVID-19? So 80% are asymptomatic. They don't really show symptoms. They don't have the coughing and the chills and loss of taste and things like that. So a lot of people have had coronavirus and haven't even realized it. Certainly for people who are more severely ill, they may require supportive care, but obviously, to date, there's no silver bullet or magic pill that you can take to fight off COVID-19, excuse me. When it comes to care, it's generally supportive palliative care that is designed to try to help you and get through the illness by minimizing the symptoms that you're actually feeling. Slide 16, how is it decided whether a person with a confirmed case should self-isolate or come to the hospital? So again, local health departments are going to work with CDPH and the Centers for Disease Control and Prevention to try to figure out how to manage these risks associated with coronavirus. So it's varies from state to state, county to county. There are definitely different approaches, and certainly for counties where it's very rare, they may be more aggressive with how they're going to bring people into the hospital. On to slide 17. These are guidelines for what you're actually going to do as an individual. So with slide 17, it's going to discuss social distancing and how you manage and handle social distancing. What is the appropriate fashion upon which you do so? It's recommended by public health officials. It's going to slow it down. So the further you're away, the less distance those viral droplet nuclei and whatnot can potentially spread. And 6 feet is generally the advisable distance for individuals to practice. Now again, this is a practice. This is not a hard and set policy, but you certainly see that like with many operations, grocery stores, banks, things like that, they're making it a policy that everyone remains 6 feet apart. Can they enforce that? Not really. So if I come into a store and I have, my a family member with me, we may be standing right next to each other, but certainly we try to avoid that interaction with others around us as best as possible to practice social distancing. On to slide 18, should I wear a mask? The guidance as of June 18th was that everyone should be using cloth facial coverings when they're in the general public outside the home. And this is, something with the state of California and CDPH that they've taken very seriously. So wearing a mask is something that they are practicing very regularly. Policies and practices continued. Wear the face mask. Individuals should wear them and practice social distancing and frequently wash your hands. So again, all this information has been disseminated from CDPH to the public. If you go to CDPH's page, their web pages, you can see all this information is going to be readily available to anybody that has internet access. On to slide 20. What's the state doing to protect our health? And this is kind of an outline of what the state is actually doing. You can see a hyperlink on here that you can actually go to it and see what the state is actually doing. But they've been very active in planning and working with state and local officials with access in regard to what CDPH is doing. So Riverside County Public Health, San Bernardino Public Health, Environmental Health, all these agencies are working together to do our very best to try to minimize the risk from exposure to coronavirus. So Californians were directed to stay at home to slow the spread. Testing has been made very readily available depending on what you have going on. I know I just went through a drive-through location for a friend of mine who's going to have surgery. And they actually swabbed themselves and passed it out the window to individuals who are testing for coronavirus before they have to go into the hospital, and they got their test results back in about 3 hours. I also did a coronavirus test myself when I returned from Wisconsin and had to be swabbed, a very invasive swabbing when I went to Kaiser Permanente. It was an excellent drive-through experience where I just stayed in my car and they did all the work and swabbed me and did both nostrils and then very deep inside the throat as well. So again, the state of California is doing quite a bit in regard to how they're managing this. They're looking at ensuring that students stay safe. So as you know, a lot of students have been taking online courses. They've been, obviously we here at Cal State San Bernardino through the California Department of Public Health have closed campuses and we're working remotely with our students and doing the very best we can. The National Guard was deployed to work at food banks. Millions of N95 masks have been distributed, and we really are doing the very best we can from a Department of Public Health standpoint. So on to slide 21. Can I travel? Yes, you can. Should you travel? Probably not. Unless it's an emergency, there really isn't a whole lot of reason to travel. I left the state of California to assist in caring for individuals out of state, and when I came back, it definitely was a great risk to me, and I had to remain in self-quarantine until I could get my test results back from Kaiser Permanente, which actually involved me sleeping in my car for several days to make sure that I didn't get the people around me sick who are immunocompromised. So a couple of considerations that you can take is, are you going to an area where coronavirus is rapidly spreading? So, Wisconsin, no, it wasn't really spreading there. Was I going to New York? There's no way you could have gotten me to travel to New York, and coming back to California was probably the most risky thing I did. So are those around you, traveling with you, have they been exposed to coronavirus? And can you keep 6-foot social distancing? And as I'd mentioned, you know how tight those airplane seats are. Social distancing is not happening when it comes to air travel. So can I travel? Depends. Can you take a road trip? That'd be the way to go. Jump in your car and just drive, and don't touch a single gas pump the whole way. Have disposable gloves with you, things like that. On to slide 22, guidance and information. So this, as I'd mentioned before, CDPH is going to have access information. This is a direct line that the public can call. The 833-422-4255 number. You're going to have people that are going to be there Monday through Friday, 8 to 8. Pacific time. So a good way to get questions answered if you want to talk directly to the CDPH. On to slide 23. Just some general information, policies and practices. So this is something that is rolled out in regard to how you manage health during stressful times, and this is certainly not coronavirus specific. So manage your stress, and that can be tough, especially when you're a student and trying to get by, not knowing whether your professor is going to be a raving lunatic. That's a challenge. Even dealing with traffic and affording gas in a time where work is very challenging if you're able to work at all. And managing stress can be tough. Being physically active. How do you do that now? I mean, I know for me, I have a full workout program that I do here in the house without having any weights. And certainly, I encourage you, if you like to exercise, go online and look at ways that you can exercise around the house. But if you do choose outdoor activities, go to places that are more remote. If you like to ride a bike or hike or things like that, these are great times to be doing that if you have areas that you can stay and practice social distancing. Certainly the third step, to be safe. You want to be safe. That's most important, that you can manage that. Be involved in your health care. Step 4, you definitely want to make sure that you know what you're doing. If you haven't gotten a flu shot, plan on how you're going to get that flu shot and to stay safe. If you have health care, obviously getting a flu shot can be very simple. But I know when I got my flu shot, I went into Kaiser Permanente and didn't touch a thing, going in or out, and stayed as far away from everybody as I could. But when I got into the facility, I had to touch a clipboard, and I hope that they were cleaning those clipboards after each use. So be involved in your healthcare. Eat wisely, all right? So we definitely want to eat lots of colors. And that's not to say eat a bag of Skittles to stay healthy. You want to eat the right things, and fruits and vegetables, cruciferous vegetables and things like that. Get lots of sleep, and that can be a tough one too, but we do the best we can. And then the last step is limiting alcohol. So, again, certainly limiting smoking and alcohol and things that you know are generally bad for you. Those are things that you want to try to do. On to slide 24, 7 strategies for preventing healthcare associated infections. And this is a big one, because a lot of you are going to be working in and around healthcare associated facilities. So these can be something that you really want to pay attention to. So do you have a culture of safety? Are your managers ensuring that? Are you following the guidelines and utilizing personal protective equipment? And are you being an appropriate steward of antibiotics? And then you definitely want to have a surveillance piece in place, and screening and cohort patients, making sure that you're testing these things. When you come through the door at a hospital, they're going to check your temperature, and they did the same thing when you were getting on an airplane and things like that. Environmental hygiene is sanitary, and hand hygiene, which is a very critical piece to protecting yourself in a hospital-based setting. So that's it for the first 24 slides, and this is really your presentation for Tuesday. We're going to go ahead and I'm going to stop the video here, and then I'm going to do a second video which is more focused on OSHA. I think it's going to be a little bit shorter, even though it's about the same number of slides, but we'll try to keep it under 30 minutes. So I'm going to go ahead and stop the video here and then do the next video for Thursday.